So in this video, I'm going to be talking about 3 care plan that you can write for a chest infection, all right, as well as a patient having congestive cardiac failure. So you would want to stay to the end. Also, I'm going to be talking about the top tips for this station in order for you to pass. All right, without further ado, let's dive directly into it. So your planning station is a silent writing station. Here, you are not going to be demonstrating anything. Rather, you'll be writing for 14 minutes. It is a 14-minute station, and it is going to be you and your pen. You're going to be writing on 2 nursing problems. It's worth mentioning that an acronym to guide us to writing a correct care plan is IMATTER. What is IMATTER? The E is explain, all right? What are you explaining? It is imperative you explain and discuss all aspects of care to your patients and obtain consent. So important for this station, all right? Then M, you are monitoring the vital observation, escalating as per News 2 policy. However, it is a station dependent. It is so because it is not all of the 12 assessment stations that uses News 2 charts. All right, so you're going to treat this point as the disease condition of the assessment station presents to you. All right, so another point there is assess. That's A, what will you assess? You assess the patient in case of pain, for instance. You assess this patient's level using universal pain assessment tool to know how severe the level of pain is. All right, and the next one is T. T is teach. What are you teaching this patient? For every care plan you are writing, you are teaching this patient something under the intervention. All right, you're teaching the patient something. So in case of pain, for instance, now you will teach this patient diversional therapies, such as reading or watching television. All right, next to it is another A, which is administer. You're going to administer prescribed medications, monitoring effectiveness 30 minutes as well as the side effects. All right, so next to it is R, that is refer. For every care plan you're writing, it is a problem, you've identified a problem, so you need to make a referral. So for pain, that as a case study now, that you're going to refer to pain assessment management team. And the next point to that is I. Some people say you instruct. Instruct to me is kind of disrespecting, in that context. However, you need to demonstrate and inform the patient. You need to mention the patient at any point in time. For instance, Janet, you need to demonstrate and inform Janet on the use of call bell. All right, and finally on that note, the last the last letter of the acronym is D. What are you doing with D? You document, of course. If it is not documented, it means it has not been done. So you need to document all aspects of care as planned. This is IMATTER. IMATTER will make your care plan to be as simple as it can sound. You don't need to rack your brain for, what will I write? It will guide you through what you are going to write. So write it somewhere and you make use of it in your next care plan. All right, so here are the 3 important care plans to write for any patient that is having chest infection or having a congestive cardiac failure. Number 1 is breathlessness, which could be shortness of breath, breathlessness, or breathing difficulty. These 3 are still synonymous. It could be either way, anyhow you want to use it. Another nursing problem is reduced mobility. Of course, a patient who is breathless will not be able to walk distance, would only be able to manage short distance, So reduced mobility. So for a patient who is having asthma, for instance, or pneumonia, their own reduced mobility will be because of breathlessness or shortness of breath or difficulty in breathing. And for the patient who is having CCF, the reason for reduced mobility will be due to bilateral pedal edema. Yes, one of the cardinal signs that will make you to know a patient is having chronic heart failure, you know. They will have edematous foot. It is one of the cardinal signs. Okay, so because edematous foot, they will not be able to walk distance. All right, another key thing that is common to these three problems is chest pain. There will be pain, definitely. Yeah, you cannot mention asthmatic patients without mentioning pain, as well as a patient who is having congestive cardiac failure. There will be pain, definitely. All right, chest pain. Okay, so go ahead, and anytime you are having any of these stations, yeah, there is no how these stations will be mentioned, and the patient will not be breathless. Yeah, there won't be reduced mobility, except it has been taken care of, yeah, probably before the planning station. However, there are good care plan to write. Go ahead and lay your hands on these three care plan. All right, to further simplify that, having known the problem now, your aim of care is, for instance, if a patient is breathless, the respiratory rate will be elevated, isn't it? So your aim of care is for, you mention the name of the patient. For instance, Janet. For Janet, the aim of care is Janet will have a normal respiratory pattern with respiratory rate of between 12 and 20 cycle per minute. Perfect. Could be as simple as that. All right, and for your nursing problem, you write it like this: Janet is experiencing shortness of breath due to unresolved asthma with respiratory rate of 26 cycle per minute. Yeah, it could be as simple as that. You don't need to start saying grammar and all of that. Finally, on that note, for your re-evaluation time and date, the patient's care should not be postponed because they are in difficulty, and anything that connotes difficulty needs urgent attention, isn't it? And if you will still remember, during our assessment with Janet, Janet was having difficulty breathing, and in our News 2 score, Janet was scoring 3 and had it in a single parameter. It does mean that the frequency of monitoring will be hourly. So for our re-evaluation time frame now, it will be today, the date of your exam in bracket open and close. All right, then you write every hourly. It could be sooner if the clinical condition changes. Does that make sense to you? So adopting our acronym now, the IMATTER. The E, explain and discuss all aspects of care to Janet and obtain consent. For the M, monitor and record Janet's vitals observation, especially the respiratory rate, and escalate as per News 2 policy. For A, which is assess, you assess Janet for any signs of difficulty in breathing, such as wheeze, breathlessness, or stridor. All right. Another thing is T. We are going to teach Janet to sit in up position to facilitate proper breathing. Make sure in every of your intervention, you need to state the rationale behind it. All right. So A, we are going to administer all prescribed medications, monitoring effectiveness and side effects after 30 minutes. And for R, we are going to be referring Janet to respiratory team for further plan of care and management. All right, for I, inform and demonstrate. For I, we're going to be demonstrating and informing Janet on the proper use of call bell. And D, the last point, we are going to be documenting all aspects of care as planned. All right, how simple is that? It is really, really simple. Yeah, when you use IMATTER as a guide, it's going to be very simple. The top tip here is, as soon as you get your paper, make sure you go straight to the bottom part of the paper and document your own personal details, because time might not permit you to go to it. And if it is not documented, it is not done. It is important. Yeah. Also, on those spaces where there is a nursing problem, aim of care and intervention, it's worth mentioning that it is more or less like it is 2 lines. All right, it is 2 lines to get start your sentence up and finish it down. Don't treat that line as it is single, else it will not be enough for you to write on, and you wouldn't want to point an arrow to direct it up. So start and make sure you are writing 2 full sentences or more into that space that is provided. Also, make sure your intervention, at least you will write nothing less than 5 to 6 points for you to score a full mark for this. That's why IMATTER is there. IMATTER is just like an acronym to guide you through. It does not mean that those points cannot be rearranged. It could be rearranged, but IMATTER has given us a guide and insight to what is expected of us to learn. So the remaining 2 care plan that was not discussed, I don't want this video to be overly lengthy. Just lay your hands on it, put it in the comment section, and I'm going to attend to it for us to see how well we are doing. All right, time is your enemy on the exam day. 14 minutes at home will be like 10 minutes in the examination. Yeah, that is how it is. So you need to be as accurate as you can. Another top tip is practice with your time. Do not be deceived. Don't say, I will do it when it is exam. You will not be surprised that time may not be appropriate for you. So while you're practicing at home, make sure you practice with your time. Yeah, it doesn't matter. If you don't get it now, you will get there someday. Make sure you practice with your time. Anytime, any of the skill station, practice with your time. This will guide you. If your speed and accuracy is not enough, it will propel you to re-strategize, to do things right. Your reevaluation time frame, it is not always based on what you get from your assessment. It is not news 2 based. Yeah, for instance, now if you are having homelessness as a case study, and this patient is having is at risk for infection, and you say because he got a 4 to 6 hourly in the as frequency of monitoring for assessment, and I'm going to base it on that, and my reevaluation time and date will be 4 to 6 hourly. It will be so sad to tell you that it's going to be a fail, because reevaluation time frame for a patient that is at risk for infection cannot be that short time, at least 24 hours. So it must be smart. That is the key. So I hope you've learned something in this video. It is a new channel, and without your support, it will not be a success. Please do hit a subscribe button. It is free. Yeah, absolutely free. Drop a lovely comment for us. Tell me the next OSCE station you would want me to do, and I promise to bring it to you. Until I come your way in another video, keep practicing OSCE.